Makibalita naman tayo sa mga pinakahuling update mula sa World Health Organization. We will be joined by the WHO representative to the Philippines, Dr. Rabi Abeyasinghe. Good morning, sir.
Good morning, sir.
Morning, Yusek Rocky. Good to be back.
Yeah, thank you. Dr. Rabi, may we get your reaction first on the symbolic inoculation of our essential workers in the Philippines, specifically those from the NCR Plus areas?
Rocky, this is an important question. Let me clarify. We welcome any attempt at vaccine coverage, and we recognize the critical importance of vaccinating frontline workers, a key measure to get economic revival. At the same time, I want to emphasize that WHO views the integral part of a comprehensive response, and to use the vaccines in a way that we maximize the impact of the vaccines, because we know that the vaccines reduce severe cases and deaths. And if we look at the data in the Philippines, we know that 9% of the deaths have happened in people over 45 years of age. It is really important that we use the vaccines to minimize the deaths by prioritizing these groups. And these groups have been captured in the WHO prioritization list of A1, A2, A3 groups. And so we continue to emphasize that it is important that we use the vaccines in a way that we maximize the benefit of the vaccines by reducing the cases and the deaths, while recognizing the need to bring back economic activity. So even with the vaccination of the A4 group, it would be far more impactful in the shorter term, while we deal with vaccine shortages, to start vaccinating those people of the A4 group that are above 40 years, so that we maximize the economic revival angle of it, but also maximize the reduction of severe cases and deaths. This is critically important because we are in a situation where the global situation points to circulation of multiple variants of concern, and these variants of concern localized surges in many parts, including here in the Philippines. This has to be taken in the context of when vaccines are introduced, gives optimism to the population, resulting in increased mobility. And this immobility causes a surge in COVID-19. So things have to very carefully balance out, especially because we are dealing with a limited inflow of vaccines. If we had an unlimited supply of vaccine, could rapidly roll out the vaccines to protect as many people as possible. That would be great, but unfortunately the reality is that vaccine supply is still a challenge, although we are happy to note that we are expecting increasingly larger quantities. But that means that over the next 2 to 3 months, we have to be very careful in the way we use the vaccines, how we message the population, because we already hear messages about the need for reduced compliance with minimum public standards. And we know that it's way too early with our coverage so low to go there as yet. So we have to be very careful in the messaging and the way we use the vaccine so much.
We have a question from Red Mendoza of the Manila Times. Has the WHO made its confirmation that some areas in the Philippines, specifically in NCR, are experiencing a community spread of the variants of concern? Is the DOH brief on these assumptions?
Thank you, Yusakraki. Yes, we believe that when at the results coming out from the Philippine genome for whole genome sequencing, we see that increasingly we are detecting what we now call the alpha and the beta variants circulating in the Philippines. The alpha, as you recall, was previously known as the UK variant, and the beta variant was the South African variant. So we are seeing a large proportion of sequenced samples confirming these variants circulating, and this is attributed to their increased transmissibility. So on a global scale, step back, we see that when these variants come, because of their increased transmissibility, they displace the type and they become the predominant viral the type that is circulating. Of course, the evidence we have is because of the very limited capacity for whole genome sequencing in the country. We do 700 on a weekly basis samples. So in light of this, it would be safe to assume that increased proportions of this alpha and beta variant are pointing to the fact that, like in many countries, these variants are displacing the type and becoming the predominant type. And this could also explain why we are seeing continuing cases in many places. But let me reiterate that these variants of concern can still be controlled by following the protocols that we've been following from the beginning, the minimum public health protocols. These variants of concern still amenable. They are controlled by the vaccines. The vaccines prevent disease and death even in the presence of these variants. So while we are concerned about their presence, what we are doing, if we do properly, we can still control their transmission and suppress the surges. So we advocate for all local units, the national government, to continue to implement the measures we've been deploying from the beginning of this pandemic, because we believe that even with the circulating these variants, we can still control the situation. Thank you.
Another question from Red Mendoza. Dr. Rabi, is the Philippines assured of more doses aside from the more than 4 million doses that will be arriving this week from the COVAX? When can the Philippines expect its donations from the U.S. government that will be coursed through COVAX?
So let me clarify that. It's an important question. We expect about 2.2 million doses of vaccines from the COVAX to arrive on the 11th of this month. That is the Pfizer vaccines. Although we are expecting another 2 million AstraZeneca doses to arrive, we still don't have the exact dates on when they will arrive. So it's most likely that it's not going to be, but sometime later during this month. As we've said from the beginning, the COVAX facility is committed to provide adequate vaccines to protect 20% of the Philippine population. And we are optimistic, particularly our last donors meeting that we had in Japan, and we want to acknowledge significant donation commitments from the government of Japan. We do believe that subject to manufacturing capacities, the COVAX will be able to honor commitment and deliver vaccines to protect the most vulnerable 20% in the Philippines.
Dr. Rabi, question from Laila Salaver, Inquirer. What does the WHO say about the plans to expand the vaccination program to include those below 18 years old and as young as 12 years old?
The issue of vaccinating younger people needs to be taken in the context of access to vaccines. And the vaccines, as I already mentioned, need to be used to protect those people at high risk. So if we have if vaccines that are being used in the Philippines are cleared for those age groups above 12 and are registered by the Philippine FDA, they may be used to protect vulnerable people within that age group. Because clearly there are immunocompromised individuals, there are people suffering from health conditions that are prioritizing them once we know that there are effective vaccines. But these should not be for the general population of 12 to 18 years. From a general population perspective, we need to try to protect the elderly as a priority. And once those groups are age groups, and then to adolescents. Thank you.
For joining us today, Dr. Rabi Abeyasinghe, World Health Organization representative to the Philippines. Mabuhay and stay safe, Dr. Rabi.
Thank you very much, Jackie. Pleasure.